Good afternoon, everyone. My name is Dr. Marjorie Dixon, and I am the founder, CEO, and medical director of Anova Fertility and Reproductive Health in Toronto, Canada. And I'm here today to speak to you about donor egg and embryo creation options, how a Canadian clinic can support intended parents. So in today's agenda, I'm going to be covering the Anova way, or why Anova, the difference between the regulations in Canada versus the UK, why technology matters, and then importantly, the costs in Canada. So why Anova, or why I created Anova Fertility? So I am a mother through IVF and donor-conceived children who are now grown. And when I experienced my journey, it was important to me to feel included, and I felt very excluded from the process. Also, there were things I noticed as a patient that made me really think that it was important to be patient-centric. And so that was at the beginning of the inception and the ideal for Anova. I wanted to be able to provide expert care in a supportive environment, so empathetic, though sage, because we do have the wisdom and the expert knowledge, but we need to be able to share that and impart the knowledge to our patients to empower them through their journeys. Canada's only next generation embryology lab, because I had trained abroad and came back to Canada, and it felt as if I was stepping back in time. So I wanted to be able to bring best-in-class international level and standards of care to Canadians and to others who came to Canada for their fertility care. And finally, this has been a huge passion project for us because we wanted to coordinate care for families seeking egg donors and surrogates, leveling the playing field for what had typically been a very heterosexist approach to infertility and the requirement for donor eggs or gametes and gestational surrogacy. So we wanted to all our patients to know that everyone was welcome at Anova, and that we would give them the best-in-class care. So the difference between the regulations in Canada or UK are not that far apart. That's because Canada was based in the British system. However, Ontario, where Anova is situated, is different and better, or there's a beneficial implication by virtue of the law. So parentage at birth for intended parents through gestational surrogacy and egg donation is something that is conferred from the beginning of the process. So in Canada, the intended parents at the beginning of the journey are actually included on the birth certificate at the end of the journey. So much as the gestational surrogate will give birth, it is expected and understood that the intended parents have legal rights in Canada in the province and jurisdiction of Ontario. In the UK, when a surrogate is used, the surrogate and their spouse or partner will be the child's legal parents at birth, and there needs to be a legal parenthood that's transferred by adoption or conferred by adoption at birth. So that's a little bit different. Also in Canada, surrogacy agreements are required, and surrogacy, though they're encouraged in the UK, are not enforceable by UK law. Okay, so they're still encouraged, but in Canada, they're required, and you must have them in order to initiate the process. And then finally, similarly, surrogacy payments and expenses in Canada and in the UK need to be altruistic. In Canada, you can't receive payment, but you can have compensation for expenses that are directly and indirectly related to the cycle, which is similar in the UK. Okay. So specializing in assisted reproduction, why should Anova Fertility be the #1 option when it comes to assisted reproduction? Because we have many experienced and highly trained specialized professionals in this realm. It is a supportive and evidence-based practice. So though I am a physician outside of a hospital, I am still affiliated at a hospital and an assistant professor. I still conduct research in the lab and at the hospital, and contribute to publications, as well as the training of those people who are going to go on into their careers to do fertility care. And so we are constantly kept on our toes with having to be innovative and at the head of our game in as much as the fertility industry and what we are providing to stakeholders, our patients. It's an inclusive care environment, because that was also very important for me, being part of the LGBTQ2SI+ community, to have an inclusive environment for fertility care, because often those in the community were excluded and didn't feel welcome. And it was important for me to recognize everyone who comes to parenthood. And then we are accredited and reputable with the affiliations that we have with egg donor agencies and gestational surrogacy agencies. So we have vetted them legally, and also from the perspective of equitability and non-coercion, because that was important for us as our parents, intended parents, would be looking to egg donation and gestational surrogacy, that it was in a non-coerced environment. And then we wanted to make sure that the process was as seamless as possible, because the journey can be fraught with difficulties, both emotionally, financially, and just going into a realm that was basically unknown to our patients. We wanted to be able to make the process as seamless as possible. So why technology matters? So from its inception, the Anova lab was built to differentiate itself from the other labs that existed in Canada. So we actually have the only next generation air quality system management. Our mechanical room is sort of like a spaceship, because it is designed for air quality optimization and to create the best environment for the embryos to grow. Also, the technology that we have, in as much as our micromanipulations tables and stations, being temperature controlled, oxygen tension, every single material that was put into the building of the lab is non-off-gassing, and therefore does not create toxicity for the embryo. So everything was very contrived. And furthermore, we were one of the first labs to routinely employ something called pre-implantation genetic testing for aneuploidy, which allows us to have the best success rates by virtue of the fact that we're selecting the best quality embryos genetically. And we're using the highest level of determination for understanding genetic integrity versus abnormality, using a next generation sequencing system to establish genetic normalcy versus abnormality. So technology matters, and the adeptness and ability of a lab and its operators within the lab is key to your success as future parents. So estimated cost of surrogacy and egg donation in Canada, there are a variety of components to you as you complete your journey. There are clinic fees, but that is separate from the additional things that are required by the Assisted Human Reproduction Act in Canada. So we have to be conformed to those regulations, and it is legislated in the Assisted Human Reproduction Act in Canada, but it's also overseen by Health Canada. And so there are checks and balances that sometimes may seem arduous, but they're really critical to keeping all of the interests of everyone involved, the egg donors, the gestational surrogates, and the intended parents safe. So that means that there are additional legal fees. There are fees for the agencies that are involved that I said earlier were vetted, so the egg donor agency as well as the surrogacy agencies, and the reimbursements as well to the aforementioned within the conformities of the law. So we have to make sure that we're functioning within the stipulations of the Act to keep everyone safe. Okay. And finally, there are also insurances that can be obtained in order to cover the investment that you have, because you can recognize that these are significant disbursements that we want to be able to keep safe for you. And that's why it's so critical to be in a great lab, but also to have recourse to sometimes financial supports, which Anova also has for our patients. So we have a system called Anova Pay that allows patients to have recourse to financing as well for this journey to parenthood. And finally, just a little bit of, we have been doing this for a long time. As I said, this was our passion project. And we have patients who come to us from all over the world by virtue of the fact that Anova and Ontario is the best jurisdiction, arguably, in the world to be able to have a child, because it protects the interest through law of all of the players involved, the intended parents, the gestational surrogates, and the egg donors. So you can go upon the journey of building your family in an environment where you feel safe and supported. And that's what we're here for at Anova to do for you. So you can connect with our team and book your free consultation today. You can use this email address. You can also go to our website or do it through our social media platforms. And so we're excited to help you begin your journey towards parenthood with Anova. Thank you.